Good afternoon, everyone. My name is Dr. Linda Moll, and I'm a psychologist here at Palm Health. And I want to welcome you to this webinar about the essentials of EMDR. I want to thank you all for coming, and I really hope that you find the information that I'm going to share with you today to be helpful and useful. All right, there we go. All right. Overall, the topics that we're going to cover today are going to be: how does EMDR work? What is the definition of EMDR? What can you expect from treatment in EMDR in general and from a typical treatment session? And then I'm going to tell you the story of a client who found relief through EMDR at Palm Health. So first, what is EMDR? Well, EMDR stands for eye movement desensitization and reprocessing therapy. And it was developed by Dr. Francine Shapiro after her own experience. She would happen to be on a nature walk, and she was thinking about some of the distressing events that had happened in her own life. And while she was walking, she was very naturally looking back and forth at the sights on the trail. And as she did this, she actually noticed that her distress and her emotions started to go down, and she started to relax. And she wondered if the looking back and forth might be related to that decrease in her distress. And so she went back to begin to study this in both her research and her own practice. Now, since then, extensive research has shown that EMDR is effective in a broad range of clinical concerns. And that includes phobias, anxiety, trauma, negative self-perception, and many others. And that relief actually can be very rapid. In some studies, individuals no longer met criteria for clinical diagnoses in as few as 3 to 12 sessions. So the research is pretty clear that EMDR works. So now let's chat for a little bit about how we believe it works. The central philosophy of EMDR is that the mind is naturally inclined towards health and healing, just as the body is. And one of the most powerful mechanisms of that healing is what EMDR calls the adaptive information processing system. Now, under ideal circumstances, the adaptive information processing system helps us to absorb and process distressing events either while they're occurring or shortly thereafter. And what happens then is we experience the emotions related to those events, but ultimately those emotions fade. And then we're able to kind of file away that experience into the past where it belongs. And when an event is successfully processed, then we might think about it at some point in the future, and we might still feel emotions, but those emotions are not overwhelming or out of control. Now, on the other hand, if the event or the related emotions are too overwhelming, then our survival instinct, and that's that fight, flight, or freeze response that we've all heard so much about, it gets activated instead. And as a result, the event ends up somewhat frozen in our minds. And so then when we think about the event, or when something in the environment reminds us of it, that's what we call a trigger, then it's as if that event is happening all over again. And we experience and we have the thoughts and the emotions from the original event. So how do we know when an event is unprocessed and unresolved? Well, we kind of look at 3 main hallmarks. And the first is either emotional distress or emotional distance. And emotional distress refers to emotions that are unmanageable or out of control or overwhelming. Now, the opposite may also occur. We may experience a complete lack of emotion or sort of a numbness. And both of these reactions might happen not only when we think about the event or the memory, but kind of to day-to-day events about life in general. The second hallmark are unhelpful and distorted thoughts or beliefs, especially about the self. And some examples of this are: it was my fault, or I'm no good, or I'm not good enough, or I'm completely powerless and have absolutely no control. And finally, the third hallmark are those physical reactions, such as feeling constantly tense and on edge, sort of like we're constantly facing some kind of a physical threat and trying to defend ourselves. So these are the signs that our survival instinct has been activated and the adaptive information processing system wasn't able to do its job. Now, how does EMDR help the individual to resolve this distress and this suffering? Overall, EMDR has these goals. First is to access the memory while activating the adaptive information processing system. And we do this while working with the client to ensure that the body is in a relatively relaxed state. And EMDR uses the term window of tolerance, which means that the client might be experiencing a strong emotion, but again, it's not out of control or overwhelming, or it's not completely absent and the client isn't completely numb. Next is activation of that adaptive information processing system. And we do this through the use of bilateral stimulation, or BLS. Now, originally, we did BLS by having the client move their eyes back and forth by following the finger of the therapist, or later they might have followed a light on a light bar or something on the bottom of a computer screen. But what we've discovered since then is that other forms of BLS are also equally effective. And these are things like tapping the shoulders back and forth, which is something we call butterfly hugs, or tapping the thighs, or tapping the ears back and forth. And this provides both a tactile and an auditory BLS. And clients also can purchase clappers that they hold in their hands, and those then vibrate back and forth. One of the main purposes of BLS is to help the client achieve and then maintain dual awareness. And dual awareness simply means that the client is thinking about what's happened in the past, but they remain aware of and grounded in the present. And this dual awareness is absolutely critical to the activation of the adaptive information processing system. Now, the end result of all of this is the formation of a new network between the old memory or the event that occurred, and then more tolerable emotions, more adaptive and positive thoughts, and a more relaxed body sensation. All right, so let's say that you're a client who's coming in to look for EMDR therapy. What can you expect? Well, first of all, like many forms of therapeutic approaches, the first thing we're going to do is work with you to obtain a very thorough history. And then, because EMDR is a collaborative process, we are going to work together to identify what is the most pressing concern that you want to address or resolve. Then the second phase of treatment is what we call preparation and stabilization. And during this phase, again, we're going to work together to identify techniques that help you relax. Now, these can be strategies that were developed specifically for EMDR, or they can be things that you have done in the past that have been helpful for you. But the primary purpose of these is for state change. And that means that we want you as the client to feel empowered to change your emotional state from highly aroused to more relaxed between sessions. And this is something that we want you to be able to do not only when you think about the event or the memory, but in response to daily events as well. Once again, the therapist and the client work together to identify what's most effective for that individual. Now, also a part of phase 2 is, again, us working together to identify what are the key events in your life that you want to work on. And then we identify the first target memory that we want to process and resolve. Phases 3 and 4 of EMDR are the active desensitization and reprocessing phases. And this is what most people think of when they think of EMDR. And the first thing that we do is we're going to activate that target memory. And we do this by asking the client to tell us what is the most vivid sense of that memory. And that might be an image, it might be a smell, it might be a body sensation, or even a color. Anything that comes to mind immediately and very powerfully when the person thinks of that memory or that event. Second, we ask the client to tell us what is the negative thought you have about yourself right now when you think about that event or that memory. And then we ask them, what would you prefer to think about yourself instead? And we also ask them to tell us on a scale from 1 to 7. 1 means it feels completely false. 7 means it feels completely true. How true does that thought feel to you right now while you think about that memory? Then we will ask you, what is the emotion that you're feeling right now? And how powerful is that emotion? On a scale from 0, which means it's not disturbing at all, or it just feels neutral, to 10 being the highest disturbance that you can possibly imagine. And then finally, we're going to ask you to tell us, where do you feel that in your body? As soon as we activate that memory, we move straight into active desensitization and reprocessing. And we do that by asking you to hold in your mind that most vivid image or sense from that memory, that negative self-thought, to notice the emotions and the body sensations that you experience. And then we're going to ask you to engage in rapid, long sets of that bilateral stimulation. And then between sets, we're going to ask you to stop, take a breath, and then just tell us what you noticed, what came up, what kind of floated to the surface while you were doing that BLS. And then once you've reported that to us, then we're going to ask you to go with that and do it again. And then we just do that over and over again until the client can think about that target memory with either no emotion or at least significantly reduced emotions. Now, the most important part of this phase is for the client to simply report what comes to mind while they're doing their BLS, without any kind of judgment or expectation about what should happen. It's absolutely crucial that we simply trust that the mind knows where it needs to go in order to heal. Okay, so once the client is able to think of the memory with that greatly reduced or no emotion, then we move on to the next phase, and this is called installation. What we're doing in this phase is we're installing that positive cognition that we identified early during the activation process. And what we're going to ask you is, that positive cognition that you told us about, does that still fit when you think about the memory? And sometimes this requires a little bit of modification. So let's say that the client's negative thought is, I can't do this. And sometimes it just doesn't feel quite right to then think, I'm going to think I can do this. So we might adapt that a little bit to something like, I know that I'm a strong person and I probably can handle this. And that just might feel like it fits a little bit better. And then we'll ask you, how true does that feel when you think about the memory now? And then we ask you to hold that positive thought and the memory as you're experiencing it right now, and have you repeat again, rapid, long sets of bilateral stimulation. And then again, we repeat that over and over again until the client is able to tell us that thought feels completely true on that scale from 1 to 7. The sixth phase, the body scan, involves identifying areas of the body that are tense, painful, or uncomfortable when the client thinks of the memory. Now, we've probably all heard that phrase, the body keeps the score, when it comes to unresolved distressing events. So making sure that those body sensations are also cleared is an important final phase of EMDR. So once again, what we'll do is we'll ask you to scan your body from the top of your head down to your toes and just report where you're feeling the discomfort and what the discomfort is. Is it a headache? Do you feel, is your jaw clenched? Do you feel it in your chest, your shoulders, your stomach? Those are some common places where people often experience that discomfort while they're thinking about the memory. Then we ask them to focus on that. And again, those nice, rapid, long sets of bilateral stimulation. And then in between sets, we ask them to tell us, what are you noticing now? And then to go with that and repeat it again until all of those sensations are completely clear. Now, all of this can take anywhere from 20 minutes to as long as 20 sessions. And it depends on a lot of different things. How intense was the memory? How much trauma or other distressing experiences has the individual had? Sometimes very deeply ingrained negative self-perceptions take a little bit longer to clear. And sometimes while we're working on that original target memory, other memories can come up. We call those feeder memories. And so we have to put the target memory kind of on the back burner for a little while, focus on that memory and clear that, and then we can go back to the original target. So I've talked a little bit about EMDR in general, and so now I'd like to share with you, with this client's permission, the story of her concern, and her journey from suffering to resolution. And this is a client named Sue, and Sue was a middle-aged woman who faced a very difficult decision when her loved one fell very seriously and very suddenly ill. And almost immediately after becoming ill, her loved one's body had deteriorated to such an extent that they really had no other choice but to put them on life support. And Anne was a professional in the medical professional, and so she knew intellectually that the odds of her loved one recovering from this illness was practically non-existent. And in addition, she and her loved one had actually discussed this situation on several occasions, and they had both agreed that if they ever faced this, that they would allow the other person to die peacefully and with dignity and would not prolong their lives through artificial means. So in response to all of this, Sue honored her loved one's wishes and removed them from life support. But despite all of that, for months after her loved one's death, Sue was haunted by the memories of their last breath and by her own thoughts of what if. What if I had waited? Would they have recovered? What if I had done something different? And she sought treatment for relief from those thoughts and that intense guilt that she was experiencing, because she felt she was ready to move on from what had happened, and she very much wanted to enjoy her life again without that mental and emotional weight. So Sue's initial sessions involved obtaining a history of what had occurred, and we also talked about other things that she had done to try to resolve the problem. And then we talked about the EMDR methodology and what our philosophy was. And then Sue's memory of this event was processed using what we call the recent events protocol for EMDR, because the memories were so intense and so fresh. Now, this protocol involves preparing a narrative from the start of what happened all the way to the end. And in this case for Sue, that was from the time that her loved one fell ill all the way to a medical professional reassuring her that she had done the right thing. And then Sue and I worked together and we identified six distinct frames of that narrative. And then we determined which one was the most intense and the most emotionally distressing. And that happened to be that when she was present, when her loved one took their last breath. And we then began by actively processing that frame. And we processed that frame the same way that we talked about with the other past memories, by having her activate that and then do those sets of bilateral stimulation. Now, Sue's emotional distress and her preoccupation with this frame actually resolved pretty quickly, but she struggled more with her alternate thought, I did everything I could. And finally, we identified together a blocking belief that she was having that was preventing that thought from feeling completely true. And that blocking belief was that if she resolved this concern, that somehow that meant that her relationship with her loved one had never happened. And once she recognized this, she was able to challenge it very quickly. And once she did that, that frame cleared quite rapidly, and we were able to resolve the other frames and then the full narrative. Now, as of her last session, Sue's distress was greatly reduced. She started out at a high of 10 on that scale from 0 to 10, and by her last session, she was down to a 1. And her belief, I did everything I could, strengthened from a 2 to a 7. And even more importantly, Sue reported feeling freed from that guilt and that second guessing herself. And she'd already begun to enjoy not just the prospect, but also the reality of moving forward from what had happened. From start to finish, after a long period of being haunted by her thoughts and her feelings, Sue was able to successfully process and resolve this experience in 11 sessions. Now, I remember Sue saying to me several times, this just seems too simple. This doesn't seem like it should be working like this. And so I told her what I tell all of my clients, and that's one of the most important things to remember about EMDR. It is you and your brain that is doing the healing. All we're doing during our therapy sessions is activating that natural process within you so that that healing can happen and it can take hold. And my job is just to be the guide and the facilitator. You are the one doing the work. You are the one doing the healing. So we talked today about some basic EMDR information, how it works, what you might expect if you decide to seek EMDR therapy, and a case study about someone who experienced its results for herself. And I really hope that this information and Sue's story helps you see how EMDR can help activate the amazing healing powers of your brain. What I have here is just some resources. You might have seen that there was a picture of Prince Harry, and that was from his Good Morning America story that he did. He actually went on Good Morning America because whenever he would go to London, he was actually triggered with memories about his mother's death. And so he experienced EMDR to help him address and resolve that trauma. And so he was kind enough to not only tell his story to Good Morning America, but he actually also let them film one of his therapy sessions. And I always like that it shows him doing those butterfly hugs, which just kind of, to me, illustrates the effectiveness of that particular technique. And these other websites are for more information about EMDR from the EMDR Institute and from the EMDR International Organization. Now we will answer any questions that you might have about EMDR, about the process, or about the process. We have got about 5 minutes, so please feel free to ask any questions that you might have. I'll talk a little bit about one thing that I do. My EMDR in general does not require homework, but one thing I do ask my clients to do between sessions is to practice those state change exercises, because for a lot of reasons, and one is that helps to kind of reduce the person's baseline level of anxiety or distress. And second, it's like any other muscle. Your relaxation muscle is like any other muscle. You want to work it. And sometimes you want to work it first when you're feeling just sort of anxious or sort of distressed, and then gradually work up to when you're more and more distressed. And a lot of what I want to do is I want people to both feel empowered to do that state change. And a lot of people who have had a lot of trauma or a lot of other distressing experiences have kind of forgotten what it feels like to be relaxed and peaceful. And so I want them to rediscover and re-experience what that's like. So we do that in session. And then I also really encourage folks to practice that between sessions. We have a question about sending the links. We absolutely will send those links. And I will talk with Adelaide about how we can do that. So thank you very much for that. We will absolutely do that. We appreciate your interest. Any other questions? I appreciate so much all of you being here and wanting to learn about this. It's an absolutely astounding form of therapy, and it's very effective for all kinds of different conditions. So one other thing I can tell you about EMDR that I didn't think I was going to have time to cover, but we actually work on three prongs through EMDR, and we covered a couple of them during the webinar today. But first is we will go back to the past and look at past memories and clear and resolve those. And then second, we ask you to tell us about present triggers that represent the problem or concern that you're trying to resolve, and we will address those and clear those as well. And then one of my favorite things to do is a future template. And what we then ask you to do is to envision a situation that might represent your problem or concern. And we take that new positive cognition that you have and that new confidence, and we ask you to envision yourself going through that situation in an effective way. And then we reinforce that with that bilateral stimulation. And we do that through several different means. First, we ask you to envision that and rehearse it in your head. And then we run a movie and we do all of that. And then again, like I said, we reinforce that with the bilateral stimulation. I think the other thing that's important to know about EMDR is that some people think that it's very much had gotten its reputation by approaching trauma. And there are a lot of different kinds of things that people can find upsetting. And all of those things can be very responsive to the work of EMDR. I want to thank you all again so much for being here. I appreciate your attention and your interest in the topic. And please don't hesitate to contact us if EMDR is something that you're interested in pursuing to help you address your own concerns.